In this short axis approach, you will notice that the vessel is rounded. Move the ultrasound probe up and down to identify what is vein and what is artery. The artery is thicker walled and is pulsating. If you push down on the ultrasound probe, you will notice that the vessel collapses. This confirms that it is a low-pressure collapsible structure. There are multiple ways to do this technique. You will start by entering the skin roughly the same distance from the probe as the depth of the vessel. This will allow you to have at least a 45-degree angle of entry so the needle tip can be seen. Once you insert the needle, you want to scan the ultrasound probe up to find the tip of the needle. Taking a closer look at this cognitive aid in the bottom left-hand corner will help when finding the needle's tip. This aid is the view of the needle from the ultrasound probe's perspective. This is a great tool to help you with your ultrasound alignment and your needling. Here is a brief explanation of this cognitive aid. When you place the ultrasound probe and put the needle in the correct position, you will see this cognitive aid pop up in the bottom left-hand corner. The red line represents the ultrasound beam, and the little red dot on the top of the beam represents the probe orientation marker. If your needle is in plane, you will have good visualization, but be sure to note that probe manipulations will affect your alignment. When using this aid, if you move the needle, you can see it being moved. However, when you move the ultrasound probe, the red ultrasound beam stays stationary. When you move the ultrasound probe, you just have to imagine that the needle is stationary and that the ultrasound plane is moving from the left to the right. So, after you find the needle's tip, you will then perform the peek and slide technique. You will enter the skin as far from the probe as the vessel is deep. Then, insert the needle, and once you are under the skin, find the needle's tip by sliding the probe toward the patient's feet. Once you are certain you are looking at the needle tip, change the orientation of the needle. Next, begin by advancing the probe forward and then advance the needle in and find the needle's tip. Repeat this peek and slide technique until you are in the vessel.